Are you really ready for change or not? Hello, I'm Dr. David Hawkins. I'm the director of the Marriage Recovery Center, and I want to talk to you about intervention. We often think about intervention as being related to drug addiction, alcoholism, or some other severe kind of addictive process. But actually, intervention just simply means we're not going to tolerate something that we've been tolerating. So people come to me for change and they say, Dr. Hawkins, I'm really ready for change. And sometimes I'm not really sure about that. Are you really ready for change? Because if you're ready for change, you're going to be ready to disrupt things. You're going to be ready to change things up. You're going to be ready for your life to take a turn, which is what you want. I know that's deeply what you want, but when people come and talk to me about being ready for an intervention, being ready for change, I notice something that's kind of troubling, and that is that they cling tenaciously to their life the way it is. In other words, they're saying to me, Dr. Hawkins, I want change, but I don't really want my life to be disrupted. I don't want my finances to be disrupted for sure. I don't want my children to be impacted. I don't want my lifestyle to be impacted in a negative way. I mean, but I really am miserable and I really do want change. And so I want you to think about this. Are you really ready for change? So one of the questions to ask yourself is, what are you doing to keep things exactly the way they are? Now, I know that's a strange question. What am I doing that keeps things the way they are? Well, I don't think I'm doing anything. And I ask him to think again. Think again. What are the different ways that you conduct life every day that keeps things just the way they are? What are the ways that you are afraid? You're legitimately threatened to confront firmly. You're legitimately threatened to think about a temporary separation. You're really, it's threatening, it's scary to think about doing things differently and bringing about change. And so the first step of intervention, the first breakdown that needs to happen is within you. You have to have come to the end of your rope. You have got to have reached a point where you're looking at your life and you're saying, okay, I am ready for my life to be disrupted. I am ready for change. And I understand it's going to cost me something. But it's in that costing you something that you then open yourself up to the possibility of things really being different. Now, unfortunately, when you think about what you're doing to keep things exactly the same, is after a point in time, you're going to be found irrelevant. Ooh, that's a strong word, irrelevant. Right, I want you to be relevant. I want your words to be relevant. I want your mate or whoever we're talking about, where you want change to occur. I want them to be hearing your words and going, oh my goodness, this is going to impact me. So if you're talking and complaining, it's in all likelihood that whoever you're talking to, that you're complaining to and complaining about, that they're really finding your words to be irrelevant. Doesn't pertain to them, doesn't matter to them. And that's why we say there's got to be a breakdown that leads to the breakthrough. It's in that breakdown when things really catastrophically begin to change, where you've said, I've had it. It's intolerable. What you're doing, whoever you're talking about, and the actions that you're saying must change. When you say they are really intolerable, then you're going to be willing to do something that's going to be an intervention. You're going to do something, and people often look at me and go, I don't know what to do. I get it. It's difficult to think about this level of intervention on a 1 to 10 scale. A 1 is complaining. Many of you have done that. You've complained. A 2 is complaining firmly. Many of you have done that. A 3 is complaining firmly and beginning to pull back on some of the niceties and some of the things you begin to emotionally pull apart. And I'm not going to complete 4 through 10. A 10 is where you threaten divorce, and 9 is you separate for 3 months, and a 7 is you separate for a weekend. I don't know what level of intervention it's going to take to bring about the change that you want, but you're going to have to turn up the heat. And it's uncomfortable, and it's going to cost you something, and it's going to cost everybody in the relationship something. Life will not continue the way it has been continuing if you're really ready for change. All right, there has to be accountability. That's the last point I want to make. There has to be accountability for change. So if you're really saying, I'm telling you, this is a threat. Threat, by the way, is an okay word. It's a threat. If blank doesn't change, then blank is going to happen. And there's got to be accountability for that. So you've got to follow through. So think this through carefully. Decide what must change and what you're going to do if it doesn't change. And make your words be powerful and strong and meaningful, and then they will be found relevant. All right. What's the next step for you? The next step is possibly to participate in our intervention planning session, which you can find out about by calling our office, 206-219-0145. Okay, I want to help you get the life that you want, that you deserve, but it means letting go of the life that you have now, crossing over that shaky rope bridge of change, and then getting to the other side where change has happened and you enjoy the changes that you needed to be made, which in all likelihood, when your mate or whoever we're talking about, when they have had the breakdown that leads to the breakthrough, they're going to be finding your words relevant, and they're going to be open and receptive to a change process. Not without some pushback, but you can get there. Okay, call our office, participate in that intervention planning session. We want to help you. All right, take care.